SAPCON is keen to build up on previously implemented project in Turkana West Sub-County in partnership with UNICEF to address protection needs of another 600 vulnerable children, especially girls and their families from the host community villages neighboring the South Sudan border and the refugee population. The project will continue to strengthen protection and empowerment of children to safeguard their rights through participation of children in the Child's Right Clubs and other initiatives including Sports for Peace Clubs, providing psychosocial support to all vulnerable children across the sub-county. Advocacy on education and scholastic material support will be a key in this implementation phase, targeting out school children in the 7 administrative wards in the sub-county. SAPCON will also partner with UNHCR and County Department of Medical and Public Services to provide medical assistance to survivors of sexual exploitation, and RCK will take the lead in providing legal support for survivors to seek justice. Building on a milestone achieved in Phase 1 and 2, the project will continue to strengthen community-based children protection systems in close partnership with the Department of Children's Services, DCS, county government, Ministry of Interior, and public administration. SAPCON also intends to establish village community child protection committee in 7 wards. The organization will also reintroduce the kinship care arrangement under Turkana traditional culture system to support vulnerable children in need of care and protection with the family setup. The organization will also reintroduce the kinship care arrangement under Turkana traditional culture system to support vulnerable children in need of care and protection within the family setup. Now, with the rising cases of teenage pregnancy across the country, SAPCON has raised concern over increased cases of teenage pregnancy in Turkana West Sub-County. SAPCON Head of Program Manager Joseph Imuton observed that in the last 5 months, at least 79 cases of teenage pregnancy and defilement have been reported in the region.
As at now, we have identified 79 cases of pregnancies and defilement, and these cases, about 36 of them have delivered already. And we are providing what we are calling postnatal care. The services that we may provide to these children, because they are also children and we also need to care for them, and they also bring up other children in that case. So the child protection committees are the ones that the chiefs are the ones that identify, because we have trained them on how they handle this, and also they have a form to fill on how they need to identify this from the grassroots levels.
Imuto noted that out of the reported cases, already 36 schoolgirls have already delivered babies and they are providing home postnatal care.
Children have been identified, and through our own community protection committees, they're able to be identified orphan and vulnerable children, those who have been pregnant, those who have been defiled, and other forms of sexual exploitation and abuse. And in this case, why we are doing this is to protect children of this age, school-going age, and also to see that they're able to go to school and continue with their own education. In this time of COVID-19, I know it's a very difficult time, but what we are doing is we want to give them items so that they don't go to the streets, they don't go to child labor in the refugee camp, as much as we are focusing on Turkana West, the 7 wards, and we are targeting all the children in this sub-county. We want to say that we are preventing abuse and child protection by giving these items so that children are not lured into other sexual abuse issues.
Data from the Children's Department indicates that more than 4,000 teenage pregnancies have been recorded in the entire county, with more cases not reported due to vastness of the county. Speaking at Kakuma during the distribution of hygiene and dignity kits donated by the UNICEF, Imuton said chiefs and local community children protection committee have been tasked with ensuring that teenage pregnancy does not recur during this time of COVID-19.
We are coordinating with the Department of Children's Services, the chiefs who are under Interior and Coordination Ministry, and the DCC, plus also other partners. We have a technical working group for child protection where we discuss these issues and the remedies, especially this week. The DCC was able to provide us with foodstuffs to the DCS so that we're able to give these children that we have identified that are vulnerable, and also their families are also vulnerable. They cannot support them within this COVID-19 pandemic period.
With help and aid from the UNICEF team, we've been able to distribute dignity kits that contain basic toiletries for children. They also have delights so that they'll be able to do personal studies now that they're at home. We also trying to empower the communities on prevention of COVID-19. So at the same time, we're also targeting about 500 households within Lokichogio area with hygiene kits, as well as basic trainings on how to improve their hygiene during these tough periods.
SAPCON, in partnership with UNICEF, have also launched COVID-19 material for vulnerable children in the communities targeting aged between 10 to 14 years old and 15 to 17 years old to caution them from COVID-19 pandemic. According to SAPCON, at least 3,500 vulnerable children will benefit from the kits in the entire 7 Turkana West wards. The organization will also enhance training on positive parenting and support them with small startup capital of 10,000 shillings so that they are able to take care of their children. The head of programs said they are using Community Protection Committee to identify needy cases, especially those children that have been defiled, got pregnant, and those who have undergone other forms of sexual abuses. Deputy County Commissioner Yusuf Salat said cases of earlier marriages have escalated in the region. Mr. Salat said 9 cases of earlier marriages have been reported in Lapur ward alone, adding that the figure could go higher in the entire region since the task force was still compiling the data.
We have also created a multi-agency team comprising of National Government Administrative Officers as the team chairs, comprising of National Police Service, County Government, UNICEF, SAPCON, Probation, Courts, and Children Office to map and to disseminate presidential directives on the challenges of teenage pregnancies, and also to recommend way forward on how to reduce the teenage pregnancies. So far, I can confirm that the multi-agency team is working, and we are going around, and we have settled 2 local FM radios to disseminate further the consequence of teenage pregnancies in terms of somebody getting HIV/AIDS, in terms of teenage pregnancy.
Napokea vitu ile ya kusaidia hawa. Napokea jerrycan na sabuni ya kuosha ni mkono na ile vitu yake yote, t-shirt, longi, wasichana, leso na kila kitu, mpaka sabuni, mpaka kila kitu yote kwa ile watoto ya kuingia pomwani. Uligawa tena kama hii. Na sasa meshukuru sana sana sana.
Kitu ile ilifanya watoto kutoroka njaa na mkosefu ya vitu ya kusoma kila kitu. Na kwa wasasi hiyo kitu hawezi toka. Kwa hivyo tulisema shukrani kubwa sana, tulifurahi Mwenyezi Mungu na leta ile baraka leo iletua sisi watoto yetu pamoja na sisi msaidizi ya leo. Tuliwana.
Baada ya kutoka kwa shule hakuna kitu atakula, kwa sababu wazazi yao walikufa wengi, na pengine hata mzazi wako lakini hakuna kazi anafanya. Yeye uenda refugee kufanya nini? Kusafishia nini marefugee nguo ama vitu ama kuchota maji. Hiyo ndio inafanya nini watoto wetu waharibike kwa sababu ya njaa. Ndio amepata vitu lakini hakuna kitu atakula akitoka kwa shule. Inahitaji akitoka kwa shule apate mzazi amemtengenezea nini chakula. Hiyo chakula ndio itamrudisha nini mtoto nyumbani, akili yake, kwa sababu amepata hizo zingine lakini chakula hakuna.
Ningependa kuwashukuru shirika la UNICEF kwa vile wameweza kutusaidia kwa msaada. Sisi wengine hasukuwa na pesa za kununulia hizo vitu, wameweza kutusaidia.